Hi, this is Dr. Pandey. Welcomes you all to the Health Awareness video program. In our previous video program, we have seen the overview of parathyroid. In today's video program, let's have a glimpse of hyperparathyroidism. The word hyperparathyroidism means high parathyroid hormone levels. The word hyper means high and hypo means low. Now this is our thyroid gland, which is located inferior to the larynx and anterior to the neck. This thyroid gland, posterior of this thyroid gland have 4 parathyroid glands. Each lobe of the thyroid gland will have 2 parathyroid glands. Now the above lobe parathyroid glands are called as superior parathyroid glands, and the below lobe parathyroid glands called as inferior parathyroid glands. Now the main function of this parathyroid gland is to secrete the parathyroid hormone. Now these parathyroid glands are made up of 2 types of cells. One is oxyphil cell and other one is chief cell. Now still there is a studies going on for oxyphil cell exact function, but commonly it's been said that it's a inactive chief cells. Now these cells will produce parathyroid hormone. Now in this thyroid gland, apart from a follicular cells, there are other cell which is squeezed between the follicular cells. Those cells are called as parafollicular cell. Now this parafollicular cells will produce calcitonin. Now let's see the secretion of parathyroid hormone and calcitonin. This is a rough diagram of chief cell where it's a DNA and it's a ribosome, Golgi vesicle, and this is a receptor. Now whenever there is a low calcium levels in our blood circulation, then this calcium sensitive receptor binds with calcium and stimulates the intercellular process where DNA to mRNA, from there to ribosome, then to Golgi, from vesicle, from vesicle to into the bloodstream as a parathyroid hormone. So whenever there is a low calcium levels in our blood, it is called as hypocalcemia. That means the hypocalcemia is a primary responsible for parathyroid hormone secretion. Now let's see the calcitonin. It's a parafollicular cell, rough diagram. It's a gene and this is a ribosome, Golgi vesicle, and this is a receptor. Now whenever there is a high calcium levels in our blood circulation, then this calcium binds with this calcium sensitive receptor and it stimulates the intercellular process from DNA to mRNA, then ribosome, then Golgi, then into vesicle, from vesicle to the blood circulation in the form of calcitonin. Now that means whenever there is a high calcium level, we call it as hypercalcemia. So hypercalcemia is a prime responsible for calcitonin secretion. Now let's see the different categories of hyperparathyroidism. Till now we have seen the secretion of parathyroid hormone and calcitonin. Now the hyperparathyroidism categorized into 3. One is primary and secondary then tertiary. Now in primary hyperthyroidism, where the parathyroid hormone levels are high due to adenomas, that means benign tumors, due to carcinomas, that means cancer, due to men type 1 or type 2. What is men? Men means multiple endocrine neoplasia. Now these are the three common causes being seen in the primary hyperparathyroidism, where the parathyroid glands are secreting high parathyroid hormone levels. Now let's see the secondary hyperparathyroidism, where in the overview of parathyroid, we have seen that the parathyroid hormone functions on two ways on the kidney. One is on the nephron, other one is on the activating or synthesizing vitamin D, which we call as calcitirol, and other activities by increasing the absorption of calcium in the nephrons. Now, when there is a severe or chronic kidney disease, then the activity of the nephron or renal will reduce. Then what happens? The calcium secretion will reduce. Then vitamin D secretion will also reduce. This will stimulate the parathyroid gland, but as far as the parathyroid gland is concerned, it's functioning properly, whereas it's not been affected. The parathyroid glands are not affected, they are releasing the parathyroid hormone normally. But due to the severe or chronic kidney disease, where the improper function of the kidneys will reduce the calcium and vitamin D, then it will stimulate the parathyroid gland to increase the secretion of parathyroid hormone. That will lead to secondary hyperparathyroidism. It's not only the kidneys, even in the duodenum we have seen that this calcitirol will bind to the intercellular receptor of the duodenum in the secretion of the calcium. Now when there is a low vitamin D levels, then or due to any of the duodenal disorders, the calcium secretion will be low. That will also stimulate to parathyroid gland to increase the parathyroid hormone secretion. These are the few causes or reasons for the secondary hyperparathyroidism. Now let's see the tertiary hyperparathyroidism. In tertiary hyperparathyroidism is a continuous of or the progression of secondary hyperparathyroidism. What happens in secondary hyperparathyroidism? Due to the non-functioning of the kidneys or chronic kidney disorder, where the calcium levels or vitamin D levels have been reduced, or due to duodenal disorders where the calcium level is reduced, which initiates the parathyroid hormone secretion, that leads to secondary hyperparathyroidism. Now if this chain has continuously been stimulating the parathyroid glands for much long time, then it gets converted into tertiary hyperparathyroidism, where we will try to understand with the help of diagram. These are the parathyroid glands. It's a thyroid gland. This is into the normal. Now due to this continuous process of stimulating higher parathyroid hormone, then these thyroid glands will extend their abilities. Now this extension of the ability leads to the adenomas. When these parathyroid glands been habituated by releasing the high parathyroid hormone levels, then if due to any reason any of the signals being received by the parathyroid glands for low parathyroid hormone secretion, they will not proceed or they will not activate the low parathyroid hormone secretion. They still been producing high parathyroid hormone secretions. So for the example is this commonly been seen in the renal transplantation. So these are the categories of hyperparathyroidism and bit more information about hyperparathyroidism. With the more information related to parathyroid, we'll meet in our next video. Till then, thank you.